You'll arrive at the Missouri Center for Outpatient Surgery in the morning a couple hours before your procedure. Remember, this is located on Keene Street behind Women and Children's Hospital, across the street from the University Eye Clinic East. When you get here, you should have stopped eating and drinking by midnight. Unless you were told otherwise, it's okay to take your normal medications in the morning with a small sip of water. It's also important to ensure that you have someone to pick you up and stay with you for the night to make sure you're okay after anesthesia. You'll be greeted and checked in at the front desk where they'll go over your personal information. You will eventually be called back to the pre-surgery holding area. Anyone who came with you is welcome to stay with you here until the time of surgery. Nurses will start an IV and put some drops in your eye, and you will meet the anesthesiologist who will answer any questions you may have about your sedation. Your surgeon will be available to answer any questions about your procedure and to mark the correct eye. You'll also sign the consent form if you've not already done so in the clinic. Soon enough, you'll be rolled back to the operating room. You likely won't remember too much from this point on due to the anesthesia. While you won't be completely under, you won't feel any pain and the procedure will be a haze. Before you know it, you'll be in the recovery area. Anyone who came with you will meet you back here too. The recovery room nurse will go over some important precautions and considerations after your surgery. General precautions after eye surgery usually include: leave the patch on your eye for the first 6 hours, then start your drops 4 times a day. These will usually be given or prescribed at the surgery center. Wear the hard shield to sleep for 1 week. You may bathe, but avoid getting water directly in the operated eye for 1 week. Avoid rubbing, lifting more than 15 pounds, bending over, or straining for the first 2 weeks. These might vary depending on the type of surgery you had, but you will receive thorough instructions. The time of your next appointment will also be made clear. Sometimes these are later the same day, the next day, or even up to a month out from your surgery date. After receiving these instructions, you're free to go enjoy breakfast or lunch.